St. Vincent de Paul Clinic is really a clinic of last resort, where the uninsured, working poor and their children can come to receive quality medical and dental care. The care we provide goes beyond just medicine. We try to impact our patients' lives, especially children, through intervention, education, and prevention.
In Alhambra, we have great needs. Many of our students have never even been to see a dentist or been in a dental chair. First of all, their parents can't afford it. Secondly, their parents do not have insurance.
80 to 90% of the children that walk into our door with some type of dental need are in an urgent situation at that time. It's impossible for that child to be sitting in the classroom and learning.
The people who are serviced here at this clinic are a special group of people. They're working hard to try to make ends meet, but they don't have health care available to them.
When kids have chronic medical problems and they don't have access to basic care, oftentimes they'll end up in emergency rooms, very ill, get hospitalized, when ideally these kind of things could have been avoided.
When you have nowhere else to go, we're going to be here to take care of you or guide you where you can go. Money is always a consideration, and you try to practice in the best, commonsensical manner so that you're not doing things that you don't need to do, but the best health care is given right here.
One of the things that I'm very adamant about is that this clinic does not run like a clinic.
You're gonna have to open real wide so we can get my hands inside.
We try to squeeze in as many students as we can per session. However, we don't want to lose that individuality.
He also needs to gain their trust and become their friend.
Oh yeah, so that's been hurting some?
And some of the kids are in pain.
There's an abscess on this tooth, and that's why I guess they kept her out of school today, and she said it kept her awake all night last night.
But it's also very relieving to know that you could help this child.
We're gonna help you, don't worry, okay?
I mean, you really feel like you have made a difference in that child's life.
Give me a hug, you did great today, okay? Okay.
A lot of the people that we're seeing here haven't seen a doctor maybe for 2, 3, 4 years, a lot of the adults. Maybe they know that they have diabetes or they know that they have thyroid disease, but they haven't been on medication for a long time because they can't afford the office visit in a private office, and they can't afford the medication, and they can't afford the lab tests.
I am a single parent with 2 kids. I have a 9-year-old and a 12-year-old, and I'm working. I'm a caregiver for Arizona Bridge Independent Living, and I've been there for 5 years. So it is a struggle for me because I don't have no one to help. Then I came for my glaucoma too, so if I didn't get my medication, I would lose my eyesight, permanent.
My vision was like, I couldn't see 2 feet in front of my face. Then I started noticing a weight loss. It was like, I thought maybe it was my diet, but then I started losing like 4 pounds every week, and I knew something was wrong. And when I found out I had diabetes, it's like I was wondering, okay, where am I going to get the money for all the medicine and stuff? It's scary when you have no health insurance. If you get majorly sick, you keep wondering, what am I going to do? Where am I going to go?
When a person has a chronic illness, they still have to have a life. And so how do we help them do that? They have to learn how to take care of themselves. They have to learn where to get the supplies that might be needed. They have to learn what their limits are.
He gave me knowledge, told me what to do. So I do take my medication on a regular. I take it every single day. I don't forget.
If they're not worried about managing a medical crisis, they can hold a job. They can be productive at the job.
We would like to think that the education that we're providing, the services that we're providing, actually impact more than just the person who we serve, which in turn impacts the entire community.
By them helping me to get my medications for free, it gives me a chance to be a parent to my kids, because I know that things are so expensive. And it is a struggle for me, every day to just live on a daily basis.
So in all of that, we're really empowering a person to be able to take care of themselves if we can teach them that.
Yeah, my diet before St. Vincent's was like Danish in the morning, pizza, burger for lunch, another hamburger for supper, and candy or ice cream for dessert. And I never thought about fruits and veggies.
Here we have programs set up for lifestyle changes, for diet. And these are extremely important because that's what keeps you healthy, it helps you to get healthier, and it helps you to stay that way.
Now I'm living a healthier lifestyle. I'm eating the proper diet, getting the proper exercise. The best thing is to go for the walks in the morning or at night once the sun goes down. So you need to get the body going, and the exercise has to be there.
Dignity is really the birthright of everybody. And when healing happens, a true healing, it has to happen on all the levels of a human being. The clinic offers that opportunity because of all of the teaching we have, the psychological help that we have just about every specialty.
I've never went to a place like this that helped you so much. I mean, all they're doing is just trying to reach people and help them with their health.
I would ask anyone who's looking at St. Vincent, wondering if, they should be involved or not. I would ask them to remember that they're human, that every single one of us is related in that humanness. If they or their sons or their daughters were in a situation where they felt desperate, where they felt like there's no one to help them, I would want them to know that they could come here. I think it is a beacon to be here at this clinic, to have this clinic.